All right, welcome back to ABA Exam Review and the continuation of our BCBA practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Gladys printed out several tokens with pictures of Bluey and Bingo from the show Bluey, the client's favorite, on the front. She velcros these tokens to a token board and gives it to one of her technicians to start using with their client immediately. She tells the technician that the client must earn 4 tokens to earn reinforcement that was pre-selected beforehand. What has Gladys likely forgotten to do according to this information? So we've got kind of a not question, but it's more of a intervention evaluation question because we're looking at what Gladys hasn't done according to the information. So what do we know about Gladys so far? Well, she printed out tokens with pictures from the client's favorite show on the front. So immediately we can start to think along the lines of a token economy. Gladys is preparing this token economy for her client. She takes those tokens, gives it to her technicians to start using immediately. So immediately after creating the tokens, she wants to implement the economy. She tells the technician the client must earn 4 tokens to earn reinforcement that was pre-selected. So the reinforcement schedule, earn 4 tokens to earn the backup reinforcement. Now, based on all of that information, what has Gladys likely forgotten to do? A, select backup reinforcement. Well, in the question, it says the client will earn pre-selected reinforcement. So backup reinforcers have already been chosen because those reinforcers were selected before the start of the economy. So A is fine. What about B, pair tokens? Did Gladys at any point pair these Bluey tokens with the backup reinforcers? She didn't. She took those tokens and gave them to the technician and told the technician to start using the economy immediately. Before we can use these tokens and before this token economy can be effective, we have to pair those tokens with the pre-selected items. What about C, choose tokens the client might like? Well, it's hard to say if the client does or doesn't like the tokens, but it does seem the client likes the show Bluey, and that's what Gladys used. So we can at least say she tried to pick tokens the client might like. And then D, set a reinforcement schedule. Well, we have a schedule here, 4 tokens to earn reinforcement. So looks like some sort of fixed ratio 4 schedule. She's done that as well. What Gladys likely forgot to do was pair those Bluey tokens with the pre-selected reinforcement. And in order for tokens to have value, they must be paired with the backup items. Timothy, a behavior analyst, notices that the client spent a significant amount of time playing their favorite video game. The parents are complaining that the client is not completing their homework, so the analyst decides to restrict access to the video game until after the homework is completed. As a result, the child shows an increase in homework completion. This change in behavior is best explained by what? All right, behavior change question, and how did we accomplish the behavior change? Well, what do we know about the behavior change and what was done? We know the behavior analyst sees that the client plays this video game a lot. So in response, the parents are saying the client is not completing the homework. What does the analyst do? The analyst restricts access to the game until homework is completed. Notice how we haven't looked at answer choices yet. It's crucial that you don't go to answer choices until you fully understand the question and you've tried to at least predict maybe an answer choice. What we know so far is the analyst has restricted access to the preferred activity so that the non-preferred or the behavior we want to change starts to happen. And as a result, what happened? The behavior did change. The child started to increase homework completion. Why? Well, video game access was restricted until homework was done. So now it's a lot more beneficial for the client to complete the homework because then they can actually play their video game. So what would we refer to this as, or what is represented here? A high P request sequence. Is this a high probability request sequence? It's not. It's almost the reverse. With a high P request sequence, The high probability requests come first, followed by those low probability requests. In this case, the client has to complete the homework first to play the game. So what's really happening here is B, response deprivation. We are, or the analyst is depriving the client the opportunity to engage in the video game responses until they complete their homework. So response deprivation is tied to what? It's tied to the Premack principle. And the Premack principle says we use the opportunity to engage in highly preferred responses or activities as reinforcement for engaging in the lowly preferred or less likely responses, which is exactly what's happening here. If you complete your homework, then you get to play video games. That's the Premack principle at work. That's response deprivation at work. So this change in behavior is best explained by both B and C. A behavior analyst is observing two different reinforcement schedules for a student. The student receives reinforcement every 2 minutes on average for completing math problems and every 5 minutes on average for reading a book. Over time, the student spends approximately twice as much time on math problems compared to reading. This distribution of behavior can best be explained by what? Easy question here, if you're fluent, because this is basically a definition question disguised as something more complicated. We're talking about the distribution of behavior. And what do we mean by that? We mean the student is spending twice as much time on math compared to reading. Now, why might that be happening? Well, we have two schedules going on at the same time, and the student knows they'll get reinforcement every 2 minutes for math, but only every 5 minutes for reading. So how are they going to contact reinforcement more and quicker? Well, they need to stay on schedule A. They have to spend more time where they're going to, or they will spend more time where they're going to receive that reinforcement quicker and more often. So what they're likely going to do is complete 2 minutes of math problems, maybe another 2 minutes of math problems, and then maybe complete reading a book. And so what explains this phenomenon? Well, it's going to be A, matching law, where your behavior is going to go where reinforcement follows. That's essentially what matching law says, and it's going to be proportionate to the amount of reinforcement received based on the requirements to receive that reinforcement. Pretty straightforward question. It's not B, ratio strain. Ratio strain occurs when a schedule is thinned, and we're not talking about thinning a schedule. It's not alternative scheduling. With alternative scheduling, we've got compound schedules where the learner must either or complete a fixed or I should say a ratio or an interval schedule. And it's not contiguity of reinforcement, which just means closeness of reinforcement. What we're talking about here is the idea of matching law, where behavior is going to correspond to where reinforcement comes from and how often. During a behavioral intervention, a therapist gradually shifts from a fixed ratio 5 schedule of reinforcement to a fixed ratio 20 schedule. Over time, the child begins to display a noticeable increase in problem behaviors, including avoidance, emotional outbursts, and a decrease in task performance. What is the most likely explanation for this change in behavior? All right, another behavior change question. We have to explain the change. So what changed here? Well, the child is now engaging in more problem behaviors, avoidance, emotional outbursts, decrease in task performance. And what led to that? Well, all we know is the therapist went from a fixed ratio 5 to a fixed ratio 20. Now, what can you immediately say about this? Well, we know it's a thinner schedule, but that is a big jump. We've gone from requiring 5 responses for reinforcement to 20. That is a large jump. When we're thinning, we want to be smart about it. We want to be systematic about it. Because what's happening here is very likely that giant immediate increase in response requirements was too much for the child. Therefore, all these other behaviors are starting to occur. So what do we call this? What would explain this? A, an extinction burst. Well, we wouldn't likely say this is an extinction burst because we're not intentionally using extinction here. We're not implementing extinction. All we know is we've thinned the schedule. What about response deprivation? Well, we talked about response deprivation in the previous questions, and we're not depriving of the responses here. We're simply thinning the schedule out, but it seems like we thinned it too quickly. Therefore, it looks like ratio strain is occurring. Ratio strain occurs when schedules are thinned too quickly and that response requirement is increased too rapidly. And then behavioral contrast. Behavioral contrast occurs when a schedule of reinforcement or punishment is changed in one environment and not another. And so the behaviors move in opposite directions based on where the schedules were changed. What likely happened here, though, is simply ratio strain. We faded this way too quickly. Response requirements became too much. Therefore, we're now avoiding the task. We're not doing the task. And there are even emotional outbursts, which can all be caused by ratio strain or thinning too quickly. You've been implementing a behavior intervention plan to decrease a client's aggressive behaviors. This plan includes a differential reinforcement of other behavior schedule. After 4 weeks, you notice a decrease in aggressive behaviors, but an increase in non-compliant behaviors. How should you evaluate the effectiveness of the BIP? Now, this is kind of an ethical question because we want to evaluate our behavior plans both based on effectiveness and also from an ethical standpoint. So being effective means what we're doing is working. Now, we're trying to decrease the client's aggressive behaviors using this differential reinforcement procedure. We've done that. We're decreasing aggression, but now non-compliance has started. And so even though we're effective at our goal, we've created this whole other issue. How should we evaluate the effectiveness of the behavior plan as a whole? A, continue implementing the BIP as it is since the primary target behavior aggression has decreased. Well, we can't do that. We can't just say, well, we've accomplished our goal, we've decreased aggression, if we've increased something else we don't want to see, which is non-compliance. We've got to dig a little deeper. B, collect data on all relevant behaviors, including both aggressive and non-compliant behaviors, and analyze the data to determine if modifications to the BIP are necessary. Yes, we have our aggression data. Now we need to also evaluate this non-compliance and see, are we affecting the non-compliance or is that unrelated? And if it's related to the current BIP, then something needs to be adjusted. Maybe we need a differential reinforcement of alternative schedule where we're more precise in the replacement behavior. But all we know is we have to evaluate closely both the decrease in aggression and the increase in non-compliance. C, discontinue the DRO schedule and implement a punishment procedure to address the non-compliant behaviors. Well, that's jumping to too many conclusions. DRO seems to be effective. Aggression is decreasing. This increase might not even be related to that, and we certainly shouldn't start punishing non-compliance that suddenly appeared. So C is out. D, rely on anecdotal reports from the client's caregivers to assess the overall effectiveness of the BIP. Now, if we rely just on anecdotal reports from the client caregiver, that's not going to be enough. We need to directly observe it, and we need hard and fast data that we can visually analyze to make decisions. What we're going to do is collect data on all relevant behaviors, including both aggressive and non-compliant behaviors, and analyze the data to determine if modifications to the BIP are necessary. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.